Hey you guys, what's up? It's Rashay coming at you guys with another update. I am now 19 weeks pregnant, almost 5 months. How exciting. Today I'm gonna let you know what's been going on this past week, stuff I left out from last week, and any questions or comments you guys can leave down below. Again, still hitting you guys up from my phone. I have about 25 minutes left for this vlog, so I'll try to get as much information as I can. I just want to show you guys what I'm wearing today. I have my Auntie Rihanna Tour shirt on. Actually, underneath, pull them up real quick, they're a little too big. I have on some maternity pants from Old Navy. All maternity wear currently right now is 40% off. Not advertising them, anything like that. So far as monetary wise, just a little information out there. And this is what my stomach looks like. To me, I don't look pregnant. I look like I'm just overweight with like a big stomach. Because you can see down here, like the fanny pack thingy I was telling you guys about. But I'm definitely pregnant because my stomach was not this round before. I would have to like try to push it out or do something for it to get round. And that's about it so far with clothing. And let's get started into this video. I actually wrote down some things because I forgot to mention some things last time. So if you see me keep looking down or you hear this, this is my topic sheet. So, all right, from last time I said I didn't really have any symptoms from before. Recently, the last video I told you guys that every time I sneeze I actually was peeing a little bit. So now currently I have to wear the panty liner and I have to wear a pad because of my job. I get very sweaty because I'm outside, so a pad is a thin always pad is a ideal choice of what to wear. Also, I'm starting to have the pressure of having to pee, and when I do pee, it's hardly anything, and this is just the beginning, and I know it's gonna get worse, but that's what I'm having right now. Any other symptoms? No. I also want to talk about the tenderness and soreness of my nipples. They've been sore since I've been pregnant, since I found out I was pregnant. Around that time, I had just had my period, and throughout my period, before my period's coming and throughout the period, I have very sore nipples. So that's what I thought it was. I never thought that it would be a symptom of pregnancy, and that's what it was. Also, acne and migraines. You know, everybody breaks out with like maybe one or two like little bumps. Like I have a bump here, but I wouldn't consider it acne. My whole forehead was filled with these little bumps, like it looked like braille. It was really bad, but my forehead skin wasn't as shiny as it looks now, like oil. It was dry, and I was like, what is going on with these pimples? Why am I getting pimples all of a sudden? I should have knew that. Should have been a symptom of pregnancy, but maybe when I was around 5 weeks, it went away, thank God. And I have allergies, so currently right now I'm taking Claritin D 24 hours, and that is helping me. I was told to take it every day, but if I'm gonna be in the house and I'm not gonna go anywhere, then I don't take it. If anybody knows any other good allergy medication that you can take while being pregnant, please let me know. I'm gonna take my glasses off because I hate the glare of me talking in the lens. I can see without them. So also, I had a cold, you guys, and my doctor told me that I can take Robitussin, and I didn't trust that. Like they say like you can't take anything, and I tried Googling it, and some stuff said you can take it, some stuff said you couldn't, and I just was like, you know what, my immune system is not the best because of the pregnancy, so I'm just not going to take shit. I'm just going to make sure I take some vitamin C, give me a little bit of orange juice in there if I can. You know, I can't drink that much because of my diabetes, and just try to deal with it, try to cope with it until it's over. Another thing, I have a stuffy nose. I have one now. Right now it's on this side. Sometimes if I get on the train or the bus, like I said, my nose will get really stuffy, and I found out that that's called rhinitis. When you're pregnant, it's called rhinitis or something like that. Hopefully I'm saying it right. It's spelled R-H-I-N-I-T-I-S, rhinitis, I believe. So I have to use a humidifier. The humidifier is right here next to my bed, and I turn it on, and it's actually helping now clear my nasal passages. So I'm actually getting a better night's sleep, because before I wasn't getting a good night's sleep at all. I was exhausted. I felt like I couldn't breathe in the middle of the night because both nostrils would be inflamed and like swollen. I couldn't breathe at all. I think it's around that time where I do need a pregnancy pillow. I have a few pillows on my bed, but I need one that's nice and good to go in between my knees, because when I'm sleeping, I'm having constant knee pain. It's like my body is off. So when I'm sleeping, my knees, they hurt really bad. Even though I'm working, like like when I first started this job, every time you start anything new, any kind of job, you'll have some kind of pain because you're doing stuff in a position or in a way that you never used your body. So when I first got this job, I was really overweight. So my knees hurt, my back hurt, my hands hurt, my fingers hurt because I had to hold the mail, all kind of stuff like that. But now, because of the pregnancy, like my knees hurt. Like when I lay down on the side, because I can't lay on my back, I can't lay on my stomach like I like. I have to lay on either the left or right side. My knees start to hurt really bad. So I think it's time for a pillow. Visual weight gain versus actual scale weight gain. With my face, my friend, she always tells me that it looks like I lost weight, but to me, I've gained weight, and I feel like I don't have a jawline anymore based on the weight that I previously lost. And then, as you can see, this is how it looks when I sit down. And to me, it's like, me already being a plus size girl, this doesn't look like a pregnant stomach. This just looks like a person who's overweight and has a belly. And it's kind of frustrating, to see all these slim people with their nice round bellies, and then my belly is looking like this, and it's, I don't know. I mean, I'm not trying to get bad, feel bad about it, but it's just weird because my stomach wasn't like this before. Like, I wish you guys could have seen, or I should have been making videos before I got to this stage of pregnancy where you can see that my stomach was a little on the flat side. It was just big on the bottom right here on the part called my fanny pack. So that's that. Also, like maternity clothes. These are the first pair of maternity clothes I got. Like I said, they were 40% off, so that's why I got them. When my mom took me shopping for dresses, she bought me 2 pair of maternity pants. So I have these. And so far as work clothes, because I was a big girl, I was wearing a men's 42 waist. And before that, I was wearing, I think, a 48 or something. So I went down, and then I was about to be a 40, but then that's when I was out of work for 3 months, and then I gained weight, and then I couldn't wear none of the 42s because I probably could fit like a 44 or something. And then I lost the weight, and I could wear 42, and then I'm pregnant, and then I can't even wear the 42s. So now I had to go to the uniform store and get uniforms at size 46, and that's about to be too big for me. I mean, too tight for me. I'm going to need another size, or to get something where I could put some elastic on it. Also, remember when I told you guys about the insulin? All right, so the insulin that she tried to prescribe me to take was with the Quick Pen. It's the Humalog, right? So I'm supposed to take this right here, and I was supposed to take 5 units of it, and then they upped it to 10. And then this one is the Lantus, and I was supposed to take 10 units of this at night, and then they upped it to the 18. And then I actually had a doctor's appointment today, and I spoke to a doctor called Dr. L. But back to Dr. A, the original Dr. A that I had, she prescribed me glyburide, and this is a pill that I have to take at night. So instead of taking the insulin by needle, she said that she only wanted to monitor my sugar when I wake up in the morning. So I have to take these pills. They are so small. Like, they're smaller than like certs. They're so little. They're smaller than the little small Altoids. They're smaller than a Tic Tac. They're so little. But I'll get into these pills in a second. Today's visit. I have 15 minutes. Today's visit. I seen this lady named Dr.L. She's supposed to specialize in... What does she specialize in? Like, I also have irritable bowel syndrome, which hasn't been acting up. And I'm greatly appreciative that it hasn't been acting up. You know, knock on wood. You know what I'm saying? Because I don't want to talk anything up. Well, let me go back to symptoms. Right now, I'm starting to be gassy again. Like, extremely gassy. And it smells fucking horrible. And I can eat decent food, not greasy food, not crazy food. And it's just disgusting. So, but yeah, my IB has been pretty good. And she pretty much wanted to talk to me about my diabetes and all this stuff like that. So, when I got there, this is the same hospital, right? Because I'm thinking about leaving this hospital. So, this is my story time. I get there on time for my appointment. She comes out. She tells me to come in. Usually when you come in, I don't know about anybody else, when you go to your appointments, they go in and they check your vitals. They check your blood pressure. They check your weight. They check your... Sometimes they ask you to pee in a cup to check your urine. So she calls me in the office. I'm sitting there talking to her. She's asking me questions. And then the lady comes in like, oh, I got to check your vitals. I'm like, we're in the middle of talking. Like, why do you take my vitals now? Like, it's weird. So I stop. She checks my vitals. She says everything is good. So then I go back to the lady. When I go back to her, she begins to ask me about, because it's my first time seeing her, she begins to ask me about things that I've done prior to being pregnant. Like, have you smoked? Were you a smoker? Did you drink? Did you do this? Did you do that? So she's asking me these questions, and she asks me if I smoked. And I said, yeah, I smoked. Like hookah and stuff like that. So she's like, oh, hookah marijuana. Okay. I said, excuse me? I said hookah. Hookah's tobacco that is smoked in a, like a pipe-like device with the holes in the mouthpiece. It's tobacco. And she was like, okay, so you ever smoked anything else, like marijuana or something? I'm just looking at her like, bitch, like, are you trying to be like racially biased towards me because I'm black? Like, I gotta be fucking smoking weed? Like, what the fuck is that? That shit was making my blood boil. But I'm trying to be like, calm down, Rashay, don't spaz out on this fucking lady. Because the funny thing is, her ass is fucking pregnant too, okay? So you should already know, and you sitting there talking to me like in this kind of way. That shit was pissing me off. And then she asked me if I was drinking, and I was like, yeah, socially, I'll have a drink here or there. She was like, are you drinking now? I'm like, no. So she's like, oh, you sure you're not having anything? So I'm just like, the fuck is wrong with this bitch? Like, why is she asking me shit like this? Like, do you see anything in my file where say I used to be a raging alcoholic or some shit like that? Like, what the fuck is the problem? Like, why are you asking me stuff like this? Like, you asked me, I said no. Move the fuck on. Why are you trying to dwell on the subject? So I'm ready to like be like, you know what? I'm gonna leave because I got another appointment at a decent hospital. But my cats are fighting because I got the door closed. So, yeah, she just really pissed me off. So then, she told me that I wasn't eating enough carbohydrates. Now, with Dr. A, she told me that I don't need to eat that many carbohydrates because of the diabetes. And the nutritionist told me that I should eat more proteins, more greens. I can have some carbohydrates, but you know, a small amount. She showed me like a plate diagram. She's like, okay, if you break the plate down in 3, half of it should be protein, and then one part can be vegetable, or the other part can be carbohydrate, or it can be, you know, even smaller amount of carbohydrate, but I have to have it. And it's like, with my job, like I told you, I got to eat on the go. And the healthiest thing that I've been able to do is have a healthy breakfast, because it's a like little bagel diner place across the street. And I can get a veggie omelet. And then for lunch, I go to get my lunch, I go to 7-Eleven, and they have the pre-packed salads. And they have like yogurt, water, the mozzarella cheese pull stick slices, and what else do I get there? Sometimes they have like the apples and cheese. Now, apples have a fiber in it, but they also have a lot of sugar in it, and because of the diabetes, I can't have that, right? So she said I'm not having enough carbohydrates, and then she suggests that I eat a snack before bed. So I'm like, okay, so like what kind of snack would you suggest before I go to bed? This bitch is gonna say, oh, like a ham and cheese sandwich. I didn't know ham and cheese sandwich was a fucking snack. Are you serious? I'm like, am I in a Twilight Zone? Like, please let me know in the comments below. Like, have you guys ever experienced this? Like, I feel like this is so unprofessional. I feel like I'm at a fake doctor's office. And it's like, I don't want to say because of the location of it that it's bad, I shouldn't go there, because it's other hospitals in this particular borough that are excellent. So it's not the borough, you know, like what is it about this hospital that the overall bedside manner and the way that they interact with the patients is just like, I feel like an overall disrespect. And it's like, this is my first baby, it's my first pregnancy ever in my life. And I feel like, why the fuck do I have to deal with this shit? Like, then she told me not to take this pill at night because she wants me to check my sugar and see how my vitals are, because I told her I don't take that pill all the time, because if my sugar is below 95, I'm not going to take it, because twice I've taken it and my sugar was like low 70s and the 60s, and I felt uneasy in the morning. So I said, I'm not doing that again. So last night I told her my sugar was 94 before I went to bed, and I woke up and it was 82. That's perfect. So good thing I didn't take it. And then I told her like my overall experience, because remember I had an appointment with her earlier in my pregnancy, but I didn't go see her. So I seen her now, and I kind of filled her in with all the bullshit that I've been going through, from my midwife to Dr. A and Dr. A's assistant, and how she like made me cry with all the bullshit that she was telling me, until Dr. A's attitude and how she acted, and how I switched to the new Dr. A, the one that's really sweet and nice. And then this bitch is going to proceed, Dr. L, she's going to proceed to continue to tell me all the bad shit that can happen to my baby. How the baby can have a hole in its heart, and how I could lose the baby at any time, and how my baby could be born with all these kind of abnormalities and birth defects because of the diabetes. I'm at a 5% range. But people who are non-diabetic are between a 3 and 5% range. What the fuck is the difference? Like, so you telling me I'm in a normal range is what you're telling me. If a person who's non-diabetic is between 3 and 5 and I'm at a 5, what the fuck? You know what I'm saying? Like, why are you projecting this kind of like fear in me to stress me out, and then you turn around and say that I'm doing good? Oh, you're doing good, you're eating good, I just want you to eat a little bit more carbohydrates, and then you tell me you don't want me to take the medicine, then you tell me you want me to eat a fucking ham and cheese as a fucking snack, a sandwich. Are you kidding me? It's crazy. And then she's telling me how as the pregnancy progresses, my diabetes is gonna get worse. So I'm like, great job. You're telling me everything that I want to fucking hear. Like, you guys are being so backwards. Like, you're telling me one thing and then telling me another. Like, your information and your prognosis of everything is not consistent. It's something different all the fucking time. You know? So it's like, it's leaving me confused. So far, that's what's been going on. Once again, I'm trying my best not to be stressed out about the whole situation. Like, I just want to know that I'm not alone in this situation. You know, I want to help other people who are plus size, overweight, obese, and pregnant, and whatever they're going through and how they're being treated. And you guys can help me too. Like, leave me any comments or suggestions, especially if you have multiple children and you're a plus size woman. Please, like, help me out. Like, I want us to help each other out. This to be like a community, you know. We help each other, and you know, that's what my page is about. Also, I'm gonna buy, I get paid this week, and I'm going to buy this heart monitor for the baby so that you can hear the heartbeat. It's on Amazon. It's called Lancer Pocket 3 megahertz Pro baby monitor. And when I told you guys I heard the baby's heartbeat, they put the little thing on my stomach and you can hear the heartbeat like wow, 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 wow. So for me to feel at ease and just comfortable, if I mean, I don't have a sonogram machine. I can see the baby when I want, but I'm definitely gonna get that so that I can feel comfortable with hearing the baby's heart rate and know that I'm being a good mom and I'm doing good, and that the baby's heart rate is in the proper range that it's supposed to be in. So until next time, because I really don't have anything else to say. I mean, I already talked about my stomach and how I feel I look fat and I don't look pregnant. I really wish I did. But next week, I'm going to be 5 months. I'm so fucking excited. Like, I'm so excited. I have another sonogram coming up. I'll let you guys know about that and how that goes down. And I have another appointment in 2 weeks with Dr. A, the new Dr. A. But I'm still going to inform you guys of something new or something that happened to me, because something happens to me every fucking week. Something new happens to me. So I will let you guys in on the bullshit. Until then, I have some co-hosts that was here. They all left me. Kenji, want to come up here? Hi, come say hi. Hi. Say hi. Say hi, everybody. It's Kenji. Yeah, so I have 4 cats now instead of the 5 I originally had. But this is my baby. He likes me to hold him like a baby. Hi. So like I said, guys, please leave comments or any suggestions that you guys, would have for me in the comments below. Help me out. Let me know something. I'm in the New York City area. If you guys know of any better healthcare, any better options, hospitals or places to go, please hit me up and let your girl know. Until then, have a blessed day, a blessed week. My hair looks crazy as hell. Don't worry about that. Trying to zoom in. Until then, peace out.